This presentation is to support you with managing your energy levels, to help you understand fatigue and its symptoms, to learn how fatigue can impact on your well-being, and find out more about fatigue cycles that can occur, and for you to understand techniques which can help manage your fatigue symptoms. Give yourself a moment to consider what activities leave you feeling tired on a day-to-day basis. Has this changed recently or become more severe over time? Or maybe it's been stable and like this for a while. Think, what does fatigue mean to you? This can be different for everyone, and everyone's perception of what counts as more strenuous activity is different too. So what is fatigue? It can be classed as an extreme tiredness, resulting from a mental or physical exertion or illness. Often it can be invisible but very distressing symptom of respiratory condition. There are many other factors beside your respiratory condition which can affect fatigue. These include certain medications, overworking yourself, mental and physical health, your diet, sleeping patterns. It might feel like you live through a series of good and bad days with your energy levels, and it is difficult to strike a balance. You might be surprised to know that fatigue can affect your mental health as well. It is all very closely connected. This is due to fatigue often affecting your ability to carry out activities in the way you want to, or can affect your relationships, which in turn can affect how you feel about yourself. It can affect your motivation to carry out activities, and you may notice you start to avoid more things you feel that will be difficult to do. Here are some symptoms of fatigue you may be experiencing. These symptoms can be caused by other health conditions and situations too. So it's always recommended to speak to a health professional or doctor if you're experiencing them to further discuss it. Everyone is individual in how they experience and manage their respiratory symptoms. For some, fatigue is not such an issue and it doesn't affect their day-to-day life. For others, it can have great bearing on what they decide to do, when and where, as well as having consequences on their mood and general well-being. There are many reasons why it is a good idea to address your fatigue and the impact it is having on your life. These are just some on these slides. One of the key areas here is that your ability to do things you need to do and want to do has a direct impact on your well-being and how you feel as a person. Have you seen this diagram before? This is showing the link between fatigue and inactivity. It is showing how breathlessness symptoms you may experience can affect how you feel about carrying out an activity you need or want to do. You may feel scared about carrying out this activity and the breathlessness it may cause. This can make you start to avoid these activities even if they hold great importance to you. Over time, this avoidance can have a detrimental effect on your exercise tolerance and actually make it harder to do the activities even when you don't avoid them. This is not a useful cycle in helping you achieve your well-being. Here is another diagram of a fatigue cycle. You may feel like you have little energy. One way of dealing with this symptom may be to rest for a long period and hope your energy will start to recoup. Another way might be to ignore the signs of low energy and keep pushing through to get the task done. Either way though, you often find that frustration can start to set in. Increased stress levels and anxiety can come into play. You might notice you start to avoid situations, people, activities, and a change in mood can occur. Over time, you can start to feel socially isolated and can feel like you've lost important, valuable roles and routines in your life. Often, a person can easily keep repeating this cycle and fall into the trap of underdoing it or overdoing it, and when they are feeling fatigued. In this situation, we would advise trying to hit the middle spot, trying to gain a balance where you are doing neither, but taking regular breaks and working within your energy capacity. You may have already heard of the boom and bust cycle before. It can be a common cycle patients fall into with a range of long-term conditions. Focus on the line on the graph, this person's energy level. Imagine at the start at the graph, the person is experiencing an okay day for them and feel they have energy to complete tasks, and so decide to take advantage of this and do some jobs they've been avoiding as too difficult previously. This is called the boom. You start off your day but soon can feel like you've hit a brick wall and the energy is zapped, falling down into the bus zone. This is where you usually spend a period of time resting, trying to recuperate previous energy back. You start to feel your energy returning and try to return to your previous level of activity, only to fall back down again into the bust area by overworking in one go. This cycle will continue, but over time the rest periods tend to go on for longer and the booms of energy tend to dip lower and lower. You may start to worry about your health and notice your function is declining, whereas some of this can be contributed to the way you manage your daily routine and activities. Learning to make changes to the way you do activities through energy conservation techniques can be extremely helpful in supporting physical independence and the impact it can have on their psychological well-being. Is there anything you're avoiding in your day? People avoid things that they feel might bring on breathlessness or fatigue symptoms. The problem is, as we've started to discuss, you can miss out on important, meaningful experiences in life, and actually, in turn, the problems can just seem bigger and harder to manage. The word acceptance can be a tricky one. Accepting fatigue as part of your life can be very challenging. Most human beings have long-standing habitual routines and behaviours we have always done. Think about the way you've always had a wash, or eaten food, or got dressed, etc. Having to make changes when a health condition occurs can be difficult to adjust. Fatigue can be improved with support and changes you make, but it is important to notice that fatigue is a common symptom connected to your respiratory condition, which may be something that needs to be managed long-term rather than successfully avoiding altogether. Here at Impact Plus, we understand this and we can offer support with these difficulties at learning to find a new norm. Here are some pictures. Imagine you are in a sailing boat and you accidentally sail over the edge of a waterfall. You plunge into the bottom where there is a whirlpool and the boat breaks up. You keep attempting to climb back up the waterfall, but it is slippery and you keep falling back down. Your natural instinct is to continue to try and get back to where you were before, at the top of the waterfall. Sometimes we can be so preoccupied with looking at where we have been or who we used to be and struggling to get back at this point, such as at the top of the waterfall, that we miss the opportunity to get out of the whirlpool, the other side, where it is more accessible, perhaps where there is a ladder waiting for you. You might be able to liken this example to your respiratory condition. You might feel like having to suddenly manage all the changes that come with having a respiratory condition is like falling over the edge of the waterfall. Down into a whirlpool, everything is different and not where you want to be. You might find it a struggle each day having to complete your old routine and old way of life, a bit like trying to climb back up the waterfall. You might find that no matter how much you struggle to act like you were before, you never fully achieve this more than a day or so before fatigue sets in. Seeing the ladder to climb out of the pool the other side can be difficult to spot at first. You might not want to accept getting out that way, as it might be like admitting defeat, that you will not return to your previous independence. The upside of being out of the whirlpool is you have the opportunity to start making empowered changes that may lead you onto a new path of independence with new meaningful experiences, and although different to before, will bring well-being to your life again. Achieving this might need additional support to work out a personalised plan to manage your fatigue symptoms and the other added complications that come with this. These are some key questions to ask yourself if you are struggling to manage your fatigue symptoms. What things have you tried to improve the situation? Have they worked? What things can you think of that might have not been so helpful, that are keeping you stuck in a rut? Could this be falling into the boom and bust cycle? Maybe elements of your routine which exacerbate your fatigue symptoms. Tending to try and perform activities as you did before your respiratory diagnosis, but now you struggle with. You could try keeping a brief diary of your routine of a period of around a week. It might be useful to note how your diet was, your sleep quality, and how you were feeling in yourself. Having a look if you tended to rest during or after an activity, or completed the activity in one go. Having a look back at this diary might be helpful to identify any triggers which exacerbated your fatigue, any long rest periods which were not so effective, and you might start to notice where you can put some of the techniques we're about to talk into practice. The next slides include techniques you can use to start trying to manage your fatigue in a more effective way. The first example, pacing, can be described as the coin analogy. So imagine you get given £10 coins each day, and these coins are made of energy. Each activity you do costs different amounts of pound coins, and even your fatigue levels to start with can affect the cost of things. So the more fatigued you are, the more things cost. The idea is to learn to earn back coins throughout your day, through short periods of rest, followed by spending a coin or two through activity. When people learn to break down their activities with short rests in this way, they can over time potentially undertake more activity and generally increase independence, which in turn supports their well-being. This balance between rest and activity is unique to you and may take some experimenting to begin with. One person may only need 15 minutes, someone else might need longer. You may find resting during the activity helps you manage your fatigue and breathlessness, while someone else manages resting adequately afterwards only. Things to consider include how long the activity is going to last and how intense it will be, how close to the other activity it will be, and what's your respiratory health like today. If you're experiencing increased symptoms, activities tend to cost a little more, and you may need to react in your routine to accommodate these changes. Another example, imagine you get 15 spoons which contain energy needed for activities you undertake during the day. Different activities cost different amount of spoons. No one will be the same, depending on their fatigue levels. When you're feeling more fatigue, activities tend to cost more. The above is just one example of how someone spends their spoons. Consider how much activity in your day will cost before you commence. Even plan ahead if you can. Activities you might not think of do actually cost spoons. For example, driving, concentrating on a specific task, even if you're not physically active at that moment. Utilising this method, breaking up your day into amounts of spoons, can help avoid overworking yourself and underworking the next. It can help you in planning out your day. Other techniques include planning and prioritising skills. Consider your time management in a task. Are you feeling rushed? Could you slow it down? Or maybe complete it in another day where you have more energy? Planning is especially important when it comes to managing your fatigue symptoms. If you don't plan your week very well, for example, grouping it together, high energy tasks too close to each other, no matter how much you pace yourself, you're likely to exacerbate your fatigue. Although it seems common sense, planning ahead can be one of the biggest factors in overcoming fatigue. Working out what activities and experiences are important to you can help when deciding what to include in your routine, along with increasing your assertive skills at saying no to tasks or situations which are likely going to exacerbate your fatigue. Having a problem-solving mindset when it comes to adjusting your activity to meet your new energy needs can be very valuable. Lots of activity can still be achieved even with fatigue and breathlessness being present. Considering how you could adjust an activity to suit your needs before you commence it. This might include sitting where you can instead of standing, having particular equipment to aid your task and make the load lighter, considering your posture and how your body is positioned. Standing and bending movements can be particularly tiring and use up energy quicker rather than sitting and avoiding repetitive bending or overreaching. There are certain items of equipment that you can be assessed for by healthcare professionals in your home, which can help with getting on and off furniture or completing certain tasks, such as meeting hygiene needs. Sometimes, no matter what techniques you put into place, some jobs are just too difficult to undertake on your own with your current symptoms. You might just not find the job very meaningful or effective use of your time and energy. Having support from another person to complete a task can be hard to accept or may not be an option, but if it is, then it can be a very effective way of saving your energy for an activity that has more meaning and satisfaction to you. Relaxation exercises can have a positive impact on your energy levels and a worthwhile skill to develop and have in your routine. It can also help with coping with stress and anxiety. There are many different types of relaxation exercises, so having a go with a couple is always a good idea. Please watch our relaxation presentation. We hope this has been helpful in giving you some tools to start managing your fatigue symptoms more effectively. Please consider whether additional support from the Impact Plus occupational therapist would help you in your journey to manage your symptoms. Speak to a member of staff at Impact Plus for a referral.